So this is my fifth video from my distal bicep surgery that I had back in August of 2022. It's been 6 months and a few days, and this is just an update of where I'm at in the process, and the overall process of what I've dealt with over the last 6 months. So my previous videos, I kind of mentioned the progress I was at. It was my left arm. At this point, I'm pretty much unrestricted on what I do. The only two issues is bicep curls. I'm not quite at the weight I was working out prior to the injury. Prior to that, I was doing probably around 30 to 35 pound dumbbell curls, and right now I'm at probably in that 25 to 30 pound range. So I'm slightly less. I'll probably try to ramp it up a little more in the next few weeks, but I haven't really pushed the envelope yet. And the second thing is doing pull-ups. Really haven't tried that yet. It is kind of stressful on the bicep muscles, especially chin-ups. So I haven't really tried that yet, although again, probably in the next few weeks, month or so, I'll probably try to do at least assisted pull-ups just to see how it feels, especially in here. As far as my scar goes, I don't even know if you can see it. You can barely see it now. It's right here. It's pretty much faded, not totally away, but a good portion away. So that's what I'm pretty much at. Nothing really new. I really have no restrictions, no complications since the surgery. The only thing I'm dealing with now at times when I work out, especially pretty heavy and long, is that I do get some soreness, really pretty much in here and a little bit on the forearm, but nothing major. It does go away in a day or so, but it's not a bad soreness. It's kind of a good soreness, but not any pain at all. And I do have a little bit of numbness right here, but it's pretty much gone away. I probably have around 90 to 95% feeling back, as opposed to where it was even after 3 months, where it was maybe 80%, 75 to 80%. So it's coming back slowly. It really is not even noticeable now. So I'm hoping over the next month or 2 or 3, it comes back fully 100%. So that's pretty much it as far as my progress goes. The overall process for the 6 months, it has not been as difficult as maybe I thought it was going to be. The first 2 weeks were probably the most difficult because I didn't have use of the arm, couldn't lift anything. And then once I started physical therapy, which was pretty much probably 3.5 weeks after surgery, it got a lot better from there. I was able to lift, light things. The physical therapy obviously helped with my supinating and pronating, moving the wrist around, which I have no issues with now. Everything's fine. So, it was really the first 2 weeks, and after that, it got a lot better. And really, probably 4 or 5 weeks after surgery, I was pretty much back to normal as far as being able to do everyday things. Maybe not lifting as heavy as I was previously, but being able to at least function normally. So that's pretty much where I'm at. I think overall, I know there's a lot of postings out there of people that might choose not to do the surgery. And again, it's an individual choice. For me personally, while my job doesn't depend on it, I have a desk job. I do play sports. I do play softball. 6 months out of the year, I do play basketball periodically, not on a regular basis, but on a semi-regular basis. So I do play sports, and if I opted not to have the surgery, it definitely would have affected me, especially playing softball, because you need your wrist strength when you're hitting, and it definitely would have affected that for sure. So that was one of the reasons why I decided to have the surgery. I know there are some videos out there claiming that you can rehabilitate it, and you probably can, where you can live a normal life. But if you are active, and especially if you have a job that obviously you work with your hands and you have to lift things, twist things, whatever it is, then I don't think there's any option but to do the surgery. But again, to each his own. You do lose, if you don't do the surgery, you will lose, I think, 30 to 40% of strength. And, supinating and pronating, you also lose the ability to fully supinate and pronate. Might not seem like a big deal at the time, but when you can't do it, it becomes a big deal. And you don't realize how much you actually do that on a regular basis. Even if you don't have a job where you have to do that, it just affects your everyday life. So I do think there are people out there who opt not to have the surgery. And again, there's complications from surgery. You're always taking a chance, but it's risk reward. You have to weigh the pros and cons. And for me, surgery was really a no-brainer. And at this point, 6 months down the road, I am glad that I did it. I don't know where it would be if I didn't have the surgery. I'm sure I really would not be nearly or have nearly the mobility or the strength that I have since I had the surgery. So, for me, I sucked it up the first few weeks, which were, not fun, although not as bad as I thought. And then from there, I think it was worth it. I had no complications. People can have complications. That's always a risk. But I think it's just an individual decision. And in my case, I am glad that I did it. So this will probably be my last posting. I might do something after 1 year, because 1 year mark, sometimes also people have said that that's kind of the mark where you're, fully clear and you're 100% and there's no issues. But I haven't decided yet. So we'll see. And 1 year will be actually August of this year. So that's it for now.